Welcome to the annual staff training on concussions and return to learn, academic accommodations, return to school after a head injury. Objectives for this training include being able to define what is a concussion, discuss signs and symptoms of a concussion, and to introduce return to learn academic accommodation plans and review new concussion protocol and transitory plans. What is a concussion? A concussion is an injury to the brain that results in a temporary loss of normal brain function. They can be caused by a bump, blow, or jolt to the head. Concussions can also occur from a fall or blow to the body that causes the head to move rapidly back and forth and the brain to slosh around. All concussions are serious. Concussion symptoms may appear mild, but the injury can lead to problems affecting how a person thinks, learns, acts, and/or feels. You can't see a concussion, and some students may not experience or report symptoms until hours or days after the injury. What seems to be a minor bump to the head can be serious. Children and teens are more likely to get a concussion and take longer to recover than adults. Two people who have what appears to be the same accident can result in very different injuries. Concussions are diagnosed by a medical provider by signs and symptoms. A CT scan or MRI cannot rule out a concussion. How can concussions happen in school? Concussions can result from a fall or any time a student's head comes in contact with a hard object such as the floor, desk, or another student's head or body. The potential for a concussion is greatest during activities where collisions can occur, such as PE, playground time, or school-based sports events. Students may also get a concussion when doing activities outside of the school, but don't present with symptoms until at school. What are the signs and symptoms of concussion? There is no one single indicator for concussion. The signs and symptoms of concussion can take time to appear and can become more noticeable during concentration and learning activities in the classroom. It is important to watch for changes in how the student is acting or feeling, if students become worse or if the student just doesn't feel right. Concussion signs that can be observed include appears dazed or stunned, is confused about events, answers questions slowly or repeats questions, can't recall events prior to or after the injury, or shows behavior or personality changes. Loss of consciousness, even if briefly, but most concussions occur without loss of consciousness. Concussion symptoms reported by the student include problems with thinking and remembering, including difficulty thinking clearly or concentrating, feeling foggy, sluggish, or slowed down. Physical symptoms include headache, nausea or vomiting, balance problems, sensitivity to light or noise, blurred vision, or complaints that they just don't feel right. Emotional symptoms include irritability, sadness, nervousness, or more emotional than usual. Sleeping problems include too drowsy, sleeping less or more than usual, or having trouble falling asleep. It is important to note that symptoms can come and go and change over several days. Dr. Burris from the Sports Medicine and Injury Center reports that having a concussion is like having a severe migraine with ADHD. A concussion is a process, not an event. Symptoms may be present immediately and may progress over 72 hours. Students with a history of medical conditions such as chronic headaches, anxiety, or depression may have a harder time adjusting to the symptoms of concussion and may take longer to recover. Treatment for concussion is total brain rest. This is very difficult for young people because it includes no computer, TV, music, texting, physical activity, etc. Essentially, you're just resting in a dark room with no stimulation. Most young people with a concussion will recover quickly and fully within 7 to 10 days, but for some, symptoms can last for weeks, months, or even longer. Temporary modifications. A school nurse or an athletic trainer who assesses a student and determines they are exhibiting signs and symptoms consistent with a concussion can complete a temporary academic modification form. This form will allow the student to start receiving appropriate academic restrictions to facilitate a quicker recovery. Parents must be notified of this process. These modifications will expire in 5 school days. This should allow the student time to be seen by a medical provider to determine if there is any further or other restrictions. Here is the concussion temporary academic modification form. Return to learn. Students returning to school after the diagnosis of concussion will now be required to have a return to learn academic accommodation plan completed by a medical provider. This form should be brought to the school nurse immediately upon return to school to initiate the health alert process. The Return to Learn plan will address accommodations needed to promote cognitive rest, address sensitivity to noise and light, and to reduce risk of further injury. The school nurse will share the plans with each teacher or staff member who has direct contact with the student to review and store in their red emergency folder. Teachers and staff will be asked to sign off on these health alerts as with all other health conditions. The nurse will alert the Section 504 coordinator of the student's diagnosis. Examples of some of these accommodations include no classroom or standardized testing at this time, allowing for a shortened school day, allowing for extra time to complete assignments, or reduced time spent on the computer reading or writing, or providing an alternative setting for PE outside of the gym. Return to physical activity. This plan will indicate what level of physical activity the student is allowed to participate in. There are 5 levels of activity. All school student athletes must have a licensed physician's signature on the medical provider concussion evaluation form. The physician who has signed this form may choose to delegate the monitoring of the return to play protocol and the decision to release the student athlete to the school's athletic trainer. Once the return to play protocol has been completed and the school's athletic trainer has cleared the student athlete, the return to play form will need to be submitted with their signature and the parent or guardian's signature before the student athlete can return to participate in school sports. If the physician has not delegated the monitoring of the student athlete to the school's athletic trainer, they must, like all other students, be reevaluated and cleared by their medical provider. For students that are not athletes, the teacher with the student during PE, recess, or any class involving physical activity will need to check with the student after 20 minutes to see if they are having symptoms. If symptoms are present, the activity should stop. If the student has to stop, he or she needs to rest the next day and then return to the last day level of activity with no symptoms the following day. If the student has to restart twice, notify the school nurse so she can consult with a healthcare provider. Once a student is able to be successfully moved to day 2 of the return to play progression, all academic accommodations will stop. The school nurse will contact the parent within 2 days after the Return to Learn plan is received and health alerts have been shared to reassure that teachers have been notified of the accommodations that need to be implemented. At that time, the school nurse will also discuss plans for the follow-up visit with medical providers and provide a copy of the parent information sheet on the school's concussion protocol for the parent to read, sign, and return. The school nurse will also ask the parent for their support in promoting brain rest outside of the school. The school nurse will also inform the parent that a new Return to Learn form must be completed with each follow-up visit to the doctor. School nurses will touch base with the student and have him or her complete a post-concussion symptom checklist as needed. These checklists will be used to provide feedback to the medical provider as to how the student is doing at school. At 1 week, if the medical provider has not released the student to return to normal activities, the nurse, teachers, and 504 coordinator will meet to discuss their observations and notations about the student's classroom performance and any physical concerns. The nurse will provide this feedback to the parent and medical provider. At the 14-day mark, a meeting to implement a transitory impairment plan with teachers, parents, student nurse, 504 coordinator, and possibly an IPST member will take place. At 21 days, if the physical and academic accommodations have not been renewed, they will be discontinued. If a student's concussion symptoms last longer than 5 months, the team will meet to discuss a referral for a Section 504 eligibility. In summary, school staff need to watch for students who show increased problems paying attention, remembering, or learning new information, inappropriate or impulsive behavior during class, greater irritability, less ability to cope with stress, or difficulty organizing tasks. It is normal for a student with a concussion to feel frustrated, sad, even angry because he or she cannot return to physical activities right away or cannot keep up with the schoolwork. All concussions are serious and no 2 students will recover the same. All students with concussion will now be required to have a Return to Learn academic plan completed by the doctor. If you have any questions, please contact your school nurse. Thank you.